My name is Masaraka Mohamed from Uganda.
Jina langu ni Joy Rehema kutoka Kenya.
My name is Have Aki. I am from Nigeria.
My name is Akash. I'm from Bangladesh.
My name is Grace Adeosho. I'm from Nigeria.
My name is Brian Emmanuel, and I'm from Kenya.
The greatest challenge impacting my community is physical accessibility and lack of employment for persons with disability,
Loss of job and low income earnings.
Negative mindset of people at large regarding persons with disabilities.
Stigma and discrimination against youth with disabilities. People make assumptions on what we can do, and they doubt that we have potential.
Changamoto yangu, walemavu wa akili wanafunzwa klasi yao peke yao. Wale hawana ulemavu wa akili wanafunzwa klasi yao peke yao.
What COVID-19 has taught us is that the future of work will move to virtual space, making work seeking easier and inclusive.
Skilling in agriculture. Because of lockdown, people is resorting to agriculture as a means of survival.
A lot is needed to be done in ensuring inclusion of youth with disabilities.
Reimagining your economic opportunity means mobilize both educated and not so educated youth with disabilities.
Grants should be made available for youth with disabilities.
Skilling youth and strengthening their capacity.
Investing hugely in youth with disabilities in broader career paths.
The recognition that youth with disabilities bring unique talents and skills that drive creativity and innovation.
Learn more about Inclusive Future Initiative, www.inclusivefuture.org/work.
Wow, such a powerful video over there. And if you're joining us, wherever you're joining us from, I hope that you are feeling everything that was said in that video. You know, different people, different cultures, same issues, highlighting the importance and the need of why we are having this dialogue today. Good morning, good afternoon, good evening, depending on where you're joining us from. We are so grateful that you are able to join us here for this side event on the status of women official side event on equity and inclusion for adolescent girls everywhere, policy and advocacy approaches to promote disability inclusion, organized by the governments of the United Kingdom and Bangladesh, PMNCH and the International Disability and Development Consortium, and supported by the United States of America mission to the UN, as well as the USAID. My name is Maziko Matemvu, and I am from Malawi. I serve as the PMNCH Adolescent and Youth Constituency Vice Chair, and I am honored to be your moderator for this side event today. As you may know, people with disabilities make up about 15% of the global population. Adolescent girls with disabilities face compounding discrimination, including those related to sexual abuse, gender-based violence, and this has been exacerbated due to the COVID-19 pandemic. Yet disability has low priority within the global and adolescent health agendas. Though given that the Agenda 2030 is underpinned by the Leave No One Behind principle, we cannot reach SDGs unless people with disabilities are included and that health systems are strengthened, and promoting disability inclusion is crucial, especially is brought up as a precondition for both to build better after the pandemic and after for the achievement of the UHC and SDGs more broadly. So just a few weeks after the end of the second Global Disability Summit, through which governments and many other stakeholders made commitments to advance disability inclusion across many areas, including health, education, and employment. And in the context of CSW, this 90-minute discussion will highlight lived experiences, as well as current challenges and policy opportunities for adolescent girls, including with disabilities, outlining critical next steps to promote their inclusion in pandemic response and recovery plans particularly. So if you're joining us today, wherever you are, I hope you are feeling special. I feel special to be having this discussion right now. I feel special that I am not one of those people that are just talking about the problem. I feel special because I am here part of an important dialogue, contributing to solutions that different young girls and adolescent girls everywhere with disabilities are facing. And I hope you are as excited as I am. Thank you, Claire, earlier for sharing with us the housekeeping rules. I just also wanted to highlight that please do use the chat box for any questions, and our panelists will be able to address them. If you're like me, I'm a social media buddy. That means I am always on social media tweeting, and I just want to encourage you to please use hashtags Adolescent2030 as well as hashtag CSW66. And I just know that there's so many recommendations, so many lived experiences that will move you, but we don't just want this to move you, we want it to move the next person and the other person who was not able to join this discussion today. I would like to ask for the opening remarks by Dr. Gillian Turner. Dr. Gillian Turner is a senior health advisor in the policy division of the UK Department for International Development, focusing on a health strategy. She was formerly the policy lead for maternal, neonatal, and child health, and led the UK engagement for health in the Sustainable Development Goals. How cool is that? Pretty cool if you ask me. She has worked across countries in Africa and Asia and at a global level for the past 20 years. Over to you, Dr. Gillian Turner.
Good morning, good afternoon, or good evening, wherever you are. I'm Gillian Turner, Senior Health Advisor in the Global Health and COVID-19 Directorate of the UK's Foreign, Commonwealth and Development Office. I'm speaking on behalf of Darren Welsh, our Director, who unfortunately has COVID at the moment. The UK is proud to co-sponsor this official side event at the Commission on the Status of Women on the topic of equity and inclusion and the importance of adolescent girls and disability inclusion on the pandemic response and recovery. With over 1 billion people with disabilities in the world today, this discussion is critical to ensuring we leave no one behind in our efforts to achieve the SDGs. The FCDO believes in the importance of disability inclusion. We published our Disability Inclusion and Rights Strategy last month during the Global Disability Summit. The strategy highlights our current efforts and future intentions to mainstream disability inclusion into our global health work, including through our support for the Partnership for Maternal, Newborn and Child Health, for which we're also a co-chair of the board. People with disabilities have the same physical and mental health needs as the rest of the population, but they face higher healthcare costs, more barriers to accessing services and less health coverage. This impacts on their right to lead an independent life. We want people with disabilities everywhere to be able to access and use affordable, accessible and quality health information, supplies and services throughout their life. This has to include realising their sexual and reproductive health and rights. This is an area where people with disabilities, particularly adolescents and women with disabilities, face discriminatory attitudes and barriers. Health providers and the general public make false assumptions about their needs. Information, education and services are inaccessible to them, and they are at greater risk of experiencing violence, including gender-based violence. Consequently, they're frequently exposed to unsafe sex, unsafe abortions and sexual violence, and they face greater risks during pregnancy and childbirth. COVID-19 has exacerbated these challenges. Evidence around the world shows that people with disabilities have been disproportionately impacted, both directly through COVID infection and indirectly through reduced access to routine, general and specialised health services. It has disrupted supplies of essential medicines, immunisation programmes and accessible water, sanitation and hygiene services. As health systems recover from and continue to deal with COVID-19, we must do even more to ensure people with disabilities, particularly women, adolescents and children, are not left behind in the health sector. In addition to our disability inclusion and rights strategy, last year we also published a health system strengthening position paper and an ending preventable deaths approach paper. These show how we will mainstream disability inclusion across our broader health portfolio, including highlighting the importance of data and of involving people with disabilities and their representative organisations at country level. We aim to influence our partners to do the same. We know that multiple barriers can and must be addressed. To do this effectively, we must include and amplify the voices of people with disabilities. They must be a part of conversations around matters affecting them directly. The UK has committed to do this, and it's one reason we're co-sponsoring this panel today. I want to take a moment to thank my fellow co-sponsors, the Ministry of Health and Family Welfare in the Government of Bangladesh, the International Disability and Development Consortium, and the Partnership for Maternal, Newborn and Child Health. I also want to thank the excellent panel of speakers today who've all generously offered their time to talk to us about their own experiences. And I'll hand over the microphone to the next speaker now.
Wow, very powerful. And one of the things that I really liked that Dr. Gillian had mentioned is that there are several false assumptions that are made about young people with disabilities, which really cemented the last few words that she had mentioned, that we must include and amplify the voices of people with disabilities, and they must be part of the conversations around matters affecting them indeed. We will now hear from Andrea Prego, who is a global technical lead in inclusive health at Sightsavers, as well as the co-chair for the Inclusive Health Task Group through the International Disability and Development Consortium, on what is needed to ensure equity and inclusion. Over to you, Andrea.
Thank you, Maziko, for your introduction. Distinguished guests, the International Disability and Development Consortium, IDDC, is a network of civil society organizations promoting disability inclusion in global development. And we are proud to co-host this official side event of the United Nations Commission on the Status of Women, together with the Partnership for Maternal, Newborn and Child Health. And we are grateful to the Foreign, Commonwealth and Development Office of the UK, the Ministry of Health and Family Welfare of the Government of Bangladesh, and the United States Commission to the United Nations for co-sponsoring the event. The COVID-19 pandemic has demonstrated that when health and social protection systems are not designed with inclusion in mind, then persons with disabilities experience disproportionate levels of human rights violations. Unfortunately, this is particularly true for adolescent girls with disabilities who are subject to unique forms of violence and abuse owing to the intersectionality of their gender, age, and disability status, as well as many other factors such as poverty, migration, and sexual orientation. Adolescent girls with disabilities are 3 times more likely to have unmet needs for healthcare, and they are often denied equitable access to services and information on sexual and reproductive health and rights. And too many are subject to forced sterilization and contraception, coerced abortions, and forced marriages. This has to change and has to change now. The inclusion of persons with disabilities, and particularly adolescent girls, in the health sector has been neglected for a long time and has not been a priority in the political agendas of many countries. However, last year, the World Health Assembly adopted a resolution on the highest attainable standard of health for persons with disabilities. And as we speak today, the World Health Organization is working on a new global report on disability and health, which will provide a new framework for governments to promote disability inclusion in health systems, cross-sectoral public health interventions, and health emergencies. We live in turbulent times as we find ourselves in the midst of global environmental, health, and humanitarian crises. It is therefore crucial to understand that disability inclusion is everyone's responsibility. Everyone in the development sector needs to do their part to ensure the rights of all persons with disabilities, and in particular adolescent girls, are upheld. If we are serious about achieving universal health coverage and other SDG targets, we need more investment. We need better collaboration between governments, mainstream agencies, organizations of persons with disabilities, and development partners with disability inclusion technical expertise. And we need more quality evidence of what works to make programs and policies more inclusive. So I really look forward to hearing what our panelists have to share with us today. And on behalf of IDDC, I sincerely hope that this will be the first step of a long and prosperous journey together. Thank you.
Wow. Thank you so much for that, Andrea. Very, very powerful sentiments that you had shared there. And you are right, we cannot achieve the Sustainable Development Goals or the universal health coverage if we are leaving people with disabilities behind. And as you have said, programming and approaches that do not include the needs of people with disabilities do not address their needs. We will now have a panel discussion on what we can and what we must do to ensure inclusion and equity. What does it take to turn commitments to leave no one behind into real actions for women and girls everywhere? We will hear from a young activist from Chile, a representative from the government of Bangladesh, a professor, mainstreaming health organizations, as well as women's disabilities networks. For any questions to the panelists, please use the Q&A function, as we are planning to have a Q&A session at the end of the panel discussion to answer the questions you may have. And I just wanted to remind you, hashtag Adolescent 2030, hashtag CSW66. Let us get connected. Let us start these conversations on Twitter, Instagram, on Facebook, wherever. We need to ensure that our voices are heard today. So let us first hear from Isidora. So Isidora is a 17-year-old activist from Chile, and she champions inclusion and universal accessibility and has been representing people with disabilities from a very young age. She's the founder of Encentua tu Luwano. Apologies for my lack of better pronunciation, but this is an amazing organization which helps people with disabilities find inclusive and accessible places. She has been highlighted as a young change maker by several organizations. She is a counselor at We Have to Talk About It. We Have to Talk About Chile, an NGO that is part of the Fundación Tremendous and national gender youth activist at UN Women. And I just say she is only 17. Wow. So Isidora, what is your experience? What are your reflections and aspirations for policy advocacy approaches to promote inclusion of adolescent girls with disabilities towards universal accessibility?
Well, hello everyone. Thank you for your invitation. From my part, I want to start answering these questions because these concepts are very connected between them, because my activism started from my living experiences. First, I want to start telling you something that marked my life: to be an activist for people with disabilities, for girls with disabilities, and intersectionality. I suffered scholarly exclusion when I was 12 in my second school, and that's caused that I had to be 9 months without any school that accepted me because of my disability. And I also suffered social bullying because I have been excluded not only from my partners, I also be excluded from my teachers and the institution. So that's why I started thinking in disability in a way of, okay, we suffer discrimination, but nobody do things for disability. We are abandoned by states. If my family didn't have the money, maybe if we think another reality, I would be in my house now doing anything and being here, abandoned by everyone. And that's why I thought that we have too much to do in relation to people with disabilities to consider human rights. But we are we didn't do things. It's like, oh, okay, we talk about people with disabilities, but we never act concretely. That's why I think that we have to build a country and a world with a base on inclusion and create this something systematic, not only for minorities. Now, talking about my experience as a woman or girl, actually adolescent, with a disability, I was growing and I realized about this reality. Because when you are a child, it's like, oh, you're a girl, but nobody cares about it. And then you realize that in your country, that in the system and all things, being a woman and even more having a reality that is intersectional is the worst thing that you can have, because we suffer more discrimination. Even if we, in my country, for example, we are more women with disabilities than men. And as a very concrete example is motherhood, because when you want to be a mother and you have a disability, you are very questioned. Social services in my country, for example, ask to blind women to be mother or start judgments to them within or public services who cares about children and being part of the process of the maternity. This is awful. But even if we think that no in concrete examples, even if we think that in something in the social way, we are even not considered a typical woman, because we couldn't like do the typical role of a woman in this type of stereotypes because of the patriarchy. We can clean our houses, we can like take care of our children or husband. So that's provoked like more discrimination in the stereotype that exists on the society. That's why it's important to look forward into this topic in an intersectional way, because as Andrea said, we have different realities. If we are a woman, if we have disability, if we are in poverty, we have to look at for solution in general. And in my aspiration, well, I had to talk about my work in relation to, I am an activist who believes in inclusion, and that's why I create my organization who calls Encuentra tu lugar, but in English it could be Find Your Place. This works as a solution for basic problems that people with disabilities had, an application for help them to find parking lots, but also then I realized about other things, and that's why I create an organization who promotes inclusion in general and connects people with and without disabilities with these topics and which solutions we could create. That's why in the inclusions, we are all protagonists and we have to act. But in terms of gender, we didn't have like a specific way to act. But in my life and intersectional feminist, we do a lot of things in relation to that. And in my organizations, we try to focus on gender, specifically with also inclusion.
Yes. Wow. That is so powerful. That was amazing, Isidora. And just hearing you connect the intersectionality of all the experiences that young adolescent girls with disabilities face. And then you mentioned smashing the patriarchy. And I was just like, yes, girl, you are exactly on the right track. And you've talked about your organization and connecting young people with disabilities. And I just wanted to hear more about that. Tell us about some of the innovations you have led to really contribute to these efforts.
Well, if we want to talk about the modern science, I would say social media, it's my main tool to connect people with inclusion. And even these instances, as this panel, answering these questions or creating networks between my organization and people without disabilities with inclusion or the perspective of genders, even being a national gender youth activist and bringing the perspective of people, women, girls with disabilities into the table, I think that these are important things because we are abandoned or people had a lot of stereotypes in relation to us. when you talk about disabilities, or think that maybe health is a unique topic that we could talk when we are talking about a disability. What's that not the truth? We are people, and all rights has to be considered as human rights, not only in a way of disabilities. We have to think of our humanity, and that's the thing that it's lack of the society today. But that's my work. With my organization, we are around plus 30 volunteers, around 16 to 40 or 50 years. It's something intergenerational, and we are around our country trying to do different changes, but also create awareness, because in my country we have a lot of disability, but only in the poor children with disabilities, he's suffering, and we not suffer the disability. We suffer the discrimination that the society has bring to us.
Wow. You know what, Isidora, you should really consider writing a book, because I was just trying to type everything that you have said, and those are very powerful statements that yes, young people with disabilities are suffering from the discrimination, and it's very admirable work that you're doing with your organization, and then also smashing the patriarchy, smashing the glass ceilings, and really challenging the social and cultural norms and different barriers that different young people are facing. And I'm always saying we must not just keep talking about the problem. What are the solutions? And we're always talking about adolescents being one of the hugest cohort of the population currently in the world. And people are always like, what will adolescents bring to the table? Clearly hearing from Isidora, adolescents are the table, and they have valuable contributions, and we just want that fire to keep going. And I just also wanted to implore any other organizations that are working alongside in the same lines as you to really just reach out, so that we can really enlarge your impact, but also to stay connected. Thank you so much for your contributions, Isidora. So you've spoken about several things, and now I just wanted to talk about government's efforts, to just hear more on government's efforts to improving inclusion as regards to family planning, especially in humanitarian contexts. So with an appreciation for the critical role that governments play and how political leadership steers the action, Dr. Nerena Begum, as the line director for the Clinical Contraceptives Services Delivery Program Unit, the Ministry of Health and Family Welfare Directorate General of Family Planning for Bangladesh. Could you please share with us which initiatives the Directorate General Family Planning of Bangladesh is currently taking to ensure disability inclusion in policies? And also perhaps you could also share with us what the status is of the budget allocation to ensure inclusive SRH services for a person with disabilities. Over to you, Dr. Nerena.
Thank you. Thank you so much. Good morning, good evening, and good afternoon to you all. Would you hear me?
Yes, we can hear you perfectly.
Thank you. In our country, disability inclusive SREs is one of the focus agenda of government of Bangladesh to achieve sustainable development goal. Bangladesh government issued Rights and Protection of Persons with Disabilities Act on 2013 for ensuring different rights of persons with disabilities. Then to carry out health nutrition program of Bangladesh government, develop national strategy known as Fourth Health Population and Nutrition Sector Program. To implement this sector program, there are several operational plans as part of ensuring disability inclusive family planning services. Clinical Contraception Services Delivery Program Unit of Directorate General of Family Planning revised the operational plan and included disability issue in the operational plan for the first time in Bangladesh. Through Wish to Action project, Humanity and Inclusion provided technical support to include disability inclusive SRAs in the operational plan, which will support to ensure disability inclusive SRAs services for women and adolescent girls. We are proactive to take different action regarding inclusive family planning and SRAs in Directorate General of Family Planning activities, such as a technical working committee on disability inclusive family planning SRAs has been formed. In the committee, we included 2 OPD representatives to hear the need and difficulties of persons with disabilities directly from them. We also included inclusive SRAs in the family planning manual to ensure the capacity building of family planning service providers on inclusive HRAs issue. Then one SOP on disability inclusive SRAs has been developed. The process of development through a consultant, which is funded by UNFPA and Wish to Action project, provided technical support. Currently, we are developing an action plan in line with SOP to implement disability inclusive SRAs, where we are going to provide more emphasis on adolescent groups. Moreover, Bangladesh government developed National Health Strategy on Adolescent Health 2017 to 2030 to address the need and requirement of adolescent group. In addition, Bangladesh government developed family planning strategy for FDMN, that means Rohingya refugee as well. All these initiatives are contributing towards disability inclusive SRAs for women and adolescent girls with disabilities. You also mentioned what are the initiative or budget allocation for disabilities. We already revised our operational plan of clinical contraception service delivery program unit and allocate few budget for sensitization meeting with different type of stakeholders. Currently, the budget is not high to ensure accessibility and capacity building activities, but we have option to revise it later and allocate more budget or more money if needed. In addition, after finalization of the action plan, Director General of Family Planning will allocate more budget and involve UN and other development partner to carry out the activities which may lead to ensure quality SRA services for persons with disabilities as well as adolescent girls. I myself and my Director General of Family Planning is positive with the objective to bring SRA services to underserved through including persons with disabilities. As signatories to the CRPD, we will fulfill our obligations to accommodate action to incorporate SRA services for all the comprise the slogan, "No one leave behind." Thank you so much.
Well, thank you so much for that, Dr. Narendra. So just hearing you speak and all the work that the government in Bangladesh is really doing to mainstream SRHR and the inclusivity in the policies really just took me back to the days when I was in school. So I studied political science, and I remember when I was studying public policy, there was this definition of what public policy is by DIE 2020, if I remember. And it was a policy is what government decides to do or not to do, and just hearing about all the work that you're doing, mainstreaming SRHR into those policies and seeing the impact that it's going to have to really to have on the trajectory on what a government will decide to achieve is very empowering. And I hope that different governments that are here right now can really just take lead and follow your footsteps as well, and to really just ensure that we are including these discussions in our policies, in our laws, because it doesn't make sense if we're just having this dialogues and discourses without them being structured and cemented by policies and government action. And it was also very important when you spoke about the budget allocation, because we're always talking about what young people want, what adolescent girls with disabilities want, but we rarely hear anything on funding. So we really need to talk about funding. We need budget allocations. And thank you very much for sharing with us. So another important thing is definitely partnerships. Dr. Aresu, you work with the Humanity and Inclusion. You're also a member of PMNCH and a member of IDDC. Could you please tell us how partnership in promoting disability inclusion in the health sector, and particularly sexual and reproductive health for young people with disabilities, and why? And I think as you're sharing that with us, it would also be great to just hear you share with us some key examples of successful partnerships on inclusive SRHR. I'm just looking at the chat box, different people from different parts of the world, all working along the same lines to achieve the same goal. So I think I'm actually very excited to be hearing this from you right now. So over to you, Dr. Aresu.
Thank you. Thank you for having me here today, and good morning, good afternoon, everybody. I'm Alessandra Aresu, the Director of Global Inclusive Health Division at Humanity and Inclusion. As you said, Humanity and Inclusion is a proud partner of the Partnership on Maternal, Newborn and Child Health, and also an active member of the International Disability and Development Consortium, for which I serve as a co-chair of the Inclusive Health Task Group, together with Andrea Pregel, that we have heard just a minute ago. You asked me about the importance of partnership, and throughout the years, I have to say, Humanity and Inclusion and IDDC have been promoting multi-stakeholders partnership involving mainstream agencies, organizations of persons with disabilities, and development partners with disability inclusion technical expertise, because we believe that there was a strong need to do so in a context that until only a few years ago saw that mainstream and disability focused agencies were mostly working in silos. So when it comes to sexual and reproductive health and rights, for example, the women's rights movement, the LGBT movement, and the youth rights movement, for example, were having very little collaboration with the disability rights movement. And so this was mainly because of lack of awareness, lack of disability disaggregated data, lack of technical expertise on disability inclusion that were widespread among mainstream global health stakeholders and represented clearly barriers that prevented persons with disabilities, including youth with disabilities, to be included in the progress that were made consistently on SRHR globally. Also, thanks to these consistent influencing actions for promoting partnership throughout the years, it became clear that breaking those silos is essential to ensure that young persons with disabilities are not left behind. Because persons with disabilities are, first of all, persons. We heard already. Women and girls with disabilities are, first of all, women and girls with the same rights and very similar sexual and reproductive health needs of their peers without disabilities. So if this is the case, then the barriers and facilitators that influence their access to sexual and reproductive health information and services are not exclusively linked to their disability. Disability doesn't define them, but are the result of intersecting factors, including age, gender, sexual orientation, ethnicity, living context, and as I said, not only their disability. So an intersectional approach is therefore essential to promote inclusion, and it is therefore essential to ensure that all these factors can be taken into consideration and those barriers addressed and removed. And so the partnership of mainstream and disability stakeholders, which are built on complementarity, this is really a key word that I would like people in the audience to remember. So a partnership builds on complementarity of the different technical expertise and experiences of different partners is the key that allows us to fully translate the intersectional approach into practice and having everybody included. So to conclude on the multi-stakeholders partnership, it's important to promote sexual and reproductive health and rights of young people with disabilities because we are able to join technical and financial resources that are always limited. And we are able to put in practice some key principles that is, the first one is shared responsibility to reach all young people, including those with disabilities, complementarity in terms of technical expertise, intersectionality to address all the relevant factors, sustainability, because partnership allows us to build the capacity of all actors involved, and particularly of those of local organizational persons with disabilities and local civil society organizations to build their capacity and to make the efforts not only to be inclusive, but to be fully sustainable. And to come to the second part of your question related to the examples, there are two main examples that I would like to briefly refer to, both of partnership, as partners, members of the Partnership of Maternal, Newborn and Child Health, and both projects are supported by the UK government. The first one is between Humanity and Inclusion and Pathfinder International and different persons with disabilities and their representative organizations, and was established to address one specific gap that was the one of training materials for service providers to ensure they can offer youth-friendly, gender-sensitive, and disability-inclusive sexual and reproductive health information and services. Because we know that training service providers is key for the access of young people to the services and information. So the members of the partnership worked on an original Pathfinder International training manual for service providers. Together, we revised and made it gender, age, and disability inclusive, and then we piloted. And today it is available, open access for everybody. And I'm asking my colleague Ezra if she can put the link of the manual in the chat so that everybody can see it. And please, if you use it, share with us your impressions and your experience in using it, because this is also partnership and collaboration. And the second experience of partnership is related to the Women Integrated Sexual Health project. That is a 4 years project implemented in 16 countries by a consortium of 16 partners and led by the International Planned Parenthood Federation that is represented today here with us. This partnership is called the WISH partnership, as we call it internally, and it breaks the silos finally. We mentioned before, this is important to translate, how to translate breaking silos into practice, really bringing people together and organizations together to make sure that we are complementary and we share responsibilities. In fact, the WISH partnership also promotes the meaningful participation of local actors and OPDs, which is important, as we said, to make our partnership sustainable. And of course, WISH works in close collaboration with Ministry of Health. We have heard from the Minister of Health on Bangladesh how WISH has been operating with Bangladesh, in Bangladesh. And of course, we managed to really build the capacity of mainstream sexual and reproductive health service delivery organization, but also of organization of persons with disabilities in situation of crisis and including health crisis, and not only in development context. And here I just share a little example for the public on what does it mean working in partnership, taking it from our example in Madagascar. In Madagascar, local sexual and reproductive health service providers operated through the use of toll-free hotlines and telephone information services, and particularly during pandemic-related quarantines, patients were asked to call a hotline before coming to see a provider. And HI learned from the telephone operators that they often received what they thought were dropped calls. And they didn't realize originally that behind there could have been difficulties related to communication, or people with intellectual disabilities that needed to be receive extra support. And here the partnership between the service providers, NHI and the OPDs brought as a result the ability to bring our more users to the service provision. And to conclude, the WISH program also brings lessons learned that are collected and that are there, open for everybody to use, to make sure that we can share this experience and do better together. And I ask my colleague to send the second link in the chat so that is available for everybody. And I will stop here because Melissa from IPPF is there and ready to give more information about this partnership. Thank you, and back to you, Metizo.
Okay, thank you so much, Dr. Eresu, for that. And please, I would like to implore everybody to please check out the manuals and all the materials that are being sent in the chat box. Very important and very admirable work that is being done to ensure inclusivity. I am really loving these conversations. Like, I keep zoning out and keep remembering I have to moderate, because it's just very powerful contributions that are really just making me think. And I really just hope that we are enjoying this dialogue and this conversation. And also thank you, Dr. Eresu, for mentioning Melissa. So we are going to turn over to Melissa Cockcroft, who is the Deputy Director and technical support for Wish to Action at IPPF. So Melissa, we have heard from Alessandra about the WISH Consortium, which is led by IPPF. Could you please tell us, from the perspective of an SRHR service delivery organization like IPPF, what were some of the ways in which you worked in collaboration with HI and organizations of persons with disabilities to ensure SRHR services were made disability inclusive for adolescents and youth with disabilities during the pandemic, as well as in other crisis and humanitarian contexts?
Yeah, thanks very much. So as Alessandra already touched on, the International Planned Parenthood Federation, or IPPF, we work closely in partnership with Humanity Inclusion on the FCDO-funded Women's Integrated Sexual Health, or Wish to Action program, which has at its centre the objective of leaving no one behind, specifically people living in poverty, youth and adolescents, and people with disabilities. We know from past humanitarian crises and even before the COVID-19 pandemic that such events result in reduced access to contraceptives and other sexually reproductive health services, which in turn leads to increased rates of teenage pregnancies, which we saw in Uganda, unsafe abortions, STIs, pregnancy complications, and maternal mortality. So the COVID-19 pandemic, it actually presented us with an opportunity for IPPF to bring in HI and organisations of persons with disabilities to successfully advocate for the inclusion of sexual and reproductive health services to be recognised by governments as essential services to be maintained during the pandemic, as well as other emergencies, particularly for young persons with disabilities. So for example, in Uganda, IPPF with HI, we worked together to successfully advocate for the inclusion of persons with disabilities in district level COVID-19 task forces. This was achieved through ongoing engagement with district government officials, And through these task forces, there were new opportunities for OPDs to speak on radio talk shows, highlight issues such as increasing gender-based violence against women and girls with disabilities during the pandemic. This collaboration has since been sustained with the engagement of persons with disabilities in the health unit management committees, which is great because this will ensure that the needs of people with disabilities are involved in decision-making in the long term. Aside from working closely with governments to ensure the availability of SRH services, IPPF collaborated with HI and OPDs to conduct facility assessments to determine the gaps related to accessibility, with improvements made to facilities such as installation of ramps, improved signage, and the provision of adjustable beds. Healthcare staff were trained in inclusive service delivery, which has also helped to build their capacity to deliver counselling and services and reduce stigma towards people with disabilities, including young people. Young people from organisations of persons with disabilities were included in these trainings, with their participation really helping healthcare providers to feel more confident to serve young people with disabilities and also to understand some of their unique needs and challenges. IPPF also collaborated with HI and OPDs to identify and train people with a disability as peer educators and community health workers to raise awareness and conduct community dialogues to break down stigma for young people with disabilities accessing sexual reproductive health services. So I think you can see here that this multi-stakeholder partnership approach between service delivery organisations such as HI and OPDs are really important for strengthening the ability of service delivery organisations to reach young people with disabilities.
That's good. Just to let you know, you're currently on mute. If you could just unmute. Thank you.
Wow. Not me forgetting to unmute my mic. But as I was saying, from the perspective of an organization delivering SRHR services, what are some of the remaining challenges and gaps, particularly for making SRHR services available for adolescents and young women with disabilities, including in crises?
Yeah, so firstly, social and cultural norms remain a significant barrier for adolescents and youth accessing sexual reproductive health services and information. So in a study that HI did with Wish to Action support recently in Bangladesh and Uganda, youth and adolescents in peri-urban and rural settings found that guardians, parents and caregivers play a key role as gatekeepers in both promoting but also obstructing the fulfillment of sexual rights. Young disabled people also express a reluctance to access contraceptive services due to fear that other community members will know that they are sexually active. We also still see attitudes of some healthcare providers in the absence of training and linkages with OPDs continue to be unsupportive of young people. And of course, talking about sex or sexuality is still a taboo in the community. So it's really critical to continue to address both social norms in the community, working with, which IPPF is doing in partnership with HI and OPDs through community dialogues, peer education, working with parents and caregivers, traditional leaders and religious leaders, and of course, continuing to work closely with healthcare providers.
Yeah.
Secondly, I think another challenge we see is around policies and the enabling environment. So while we've seen gains in places like Bangladesh, we still see significant gaps in other contexts. Such policies are often particularly weak in humanitarian and emergency crisis contexts. So for example, in South Sudan, we have instances where healthcare providers have been threatened with violence by male partners for providing their spouses or their daughters with contraceptives. We've also seen pushback from governments who are not willing to approve the broadcast of edutainment videos aimed at challenging social norms around contraceptive use among young people, as it's often still deemed inappropriate or that this will encourage promiscuity. So this was the case in one country where we worked, which was a shame because we actually had a TV series which included a young male character with a physical disability who was presented as a positive role model. So there's still a lot of work that we need to do around policy and with decision makers to ensure youth access to SRHR and disability inclusion is integrated into national programs and that the enabling environment is conducive to this. And then finally, I want to mention is the final gap, I would say, or challenge is ongoing funding for disability inclusion. So donor and government funding support for SRHR and disability inclusion work, as Alessandra mentioned, it's a relatively new area. So there's still a tremendous need to continue funding to continue the work of programs such as which. I think it's also important to acknowledge that it's often quite expensive to deliver sexually reproductive health services in challenging humanitarian and emergency contexts, where health facilities are limited or often located in remote locations and not typically accessible or user-friendly for young women and girls with disabilities. So there's still a need for funding of training health providers to be able to provide appropriate counselling and services for people with a range of disabilities, ensuring informed consent, funding for improvements to health facilities infrastructure, and of course embedding disability inclusion within national policies, curriculums and guidelines. And last but not least, of course, there's also a need for funding for organisations of persons with disabilities for their activities and running costs to ensure their meaningful engagement, as we know that there can be nothing for them without them. But I'm optimistic that we're seeing a move towards more intersectional approaches and programming within the international development context.
Yeah. Well, thank you so much for sharing, Melissa. And it was actually just quite heartbreaking to hear about some of the challenges and gaps. And I think this is something that has something that keeps coming out of these dialogues and conversations is we need to start looking at human beings as human beings, you know, deserving of basic human rights. And it's just very heartbreaking to see the different barriers that are there, social, cultural, that really barricade different young people with disabilities from accessing these crucial services. But I'm also glad to hear that we're hearing the need for funding, you know, and collaboration and multi-sector approaches. And I really hope, like Andrea had said earlier, that this is just the beginning of something beyond just the dialogue and suggestions and recommendations. We really need to take action. So, Ms. Musa, the mission of the Network of Women with Disabilities in Nigeria is to empower women and girls with disabilities, to enable them, to educate them, and also to advocate for their rights in society. So what has the Network of Women with Disabilities done to promote the inclusion of adolescent girls with disabilities as part of the pandemic response in Nigeria? And I would also love to hear what your recommendations are to governments, to mainstream health agencies to promote the inclusion of adolescent girls with disabilities as part of the COVID-19 recovery process as we build towards a universal health coverage. Over to you, Ms. Musa.
All right, good morning, good afternoon, and good evening from wherever. My name is Mary, and I am the Global Secretary of the Network of Disabled Women. The Network of Disabled Women is a global community of women-led organizations of persons with disability who come together essentially to give one another support, solidarity, and support in achieving the ultimate goal of advancing the reality of an inclusive world. So during the pandemic, well, may I say that our target audience is, you know, females with disabilities, whether they're women or adolescents with disabilities or girls with disabilities. So during the pandemic, the Network of Disabled Women was able to sensitize and influence some of the government officials, like the Minister for Women Affairs, the Minister for State of the FCT, and the Minister for Humanitarian and Disaster Management. All these are female ministers because we thought that for us to be able to garner the kind of intervention that we needed to, relate and interact with women who could understand much more the conditions that our members were going through.
And so when we reached out to them, they were able to generously assist us in reaching out to members and non-members, especially adolescents with disabilities, in certain intervention schemes, one of which was the distribution of relief packs for over 3,000 members. And part of the relief packs was food items and sanitary pads. And we also went to schools, inclusive schools in particular, like the Safe Host International Academy, the government secondary school at Kuje, and the School of the Blind at Jabi. We went to these 3 schools when they still retained students during the pandemic. And then we had talk shows with the girls and educated them on menstrual hygiene, dental hygiene, and then overall hygiene, how to take care of themselves to prevent, the COVID attack. And then we also taught them on on the COVID protocols. And when the lockdown became absolute, we resorted to collaborating with the teachers, to organize virtual sessions to continue our education on their sexuality, contraception, family planning, overall hygiene, and all that. And well, it was very successful as we recorded only about 2 COVID cases from adolescent girls with disabilities. And we consider it a huge success because we know that these are people that are most vulnerable when it comes to health issues and health attacks. So we think that our intervention was able to curb that to a very maximum extent. And our recommendation to government and, partners, prospective partners, well, there are quite a lot of things that we can say, and there are quite a lot of issues that, adolescent girls with disabilities face. But I would like to highlight one, and then my recommendations will be from that particular reference point. And that is the crucial issue of early and forced marriages amongst adolescent girls with disabilities in certain geographical locations in our context. That's the Nigerian context now. And well, the reasons are not far-fetched, because when you look at the structural factors that enable the discrimination and exclusion of social protection and services, they usually create conditions for marriages, of adolescent girls with disabilities in highly compromised and vulnerable situations, because the disability usually compounds and makes them more likely to succumb to marriage propositions, and their parents, who are meant to be major decision makers, feel helpless, because they see marriage to be a tool of long-term social security and, to protect them from sexual violence of some sort. And so they give in to early and forced marriages. And the implications are devastating, not only for the adolescent girls, the victims, but also for their children, their offsprings, because we find out that because they cannot access proper and quality health care, compounded with the fact that they're young, they have to self-medicate, and sometimes when they have to, when they need maternal care and they need to put to bed, they usually resort to local and traditional methods, which usually cause them terrible infections, sometimes even leading to death. We have a very high and increasing rate of the VVF infection among adolescent girls with disabilities in, especially the northern region of Nigeria. And it's owing to these disabled social factors in terms of empowerment, poverty and all that. And so these girls cannot access facilities, and so they resort to very, very terrible situations that have devastating effects on their health. So our recommendations are very simple. We think that there should be a research, there should be further research on gathering accurate data, using global standards for adolescent girls with disabilities, because we believe that right now when you make, we have a lot of our girls, going through these things, but they do not come out to speak, for fear of being shamed or rejected or disowned by either their parents or their caregivers or even their husbands, So we believe that we need to set up global standards to collate data. And it's simple. When people are not counted, they simply do not count. And so it's very urgent and very essential. And then we also recommend that, there be more inclusivity for health facilities in terms of infrastructure and information. Buildings should be more accessible for our girls who are on the wheelchair, and then information should be more accessible to those who are deaf or who have some kind of sensory impairment, because we realize that it's not just providing health services, it's meeting them at the point of their need. So the disability community is not a homogeneous group. And so there is need also for the health workers and social workers to be trained on how to attend to specific disabilities and provide to the peculiarities of each disability cluster. This will increase the confidence of young and adolescent girls with disabilities when they approach these health facilities. And of course, when their confidence is built, they can come in properly for maternal care, for sexual counseling, and every other medical attention that they need. So we think that we continuous advocacy and putting all these beautiful steps in mind, we think that we can progress to a more inclusive world in terms of health and health facilities. Thank you.
Thank you so much for that, Mary. And it's really great to hear about all the work that you're doing. And I love looking at programs, concepts, concept notes, etc. But it's great when you also see the objectives and goals being met throughout implementation. So it's great to see that the approaches that you're using are working. But I also love the last thing that you say, that persons with disabilities are not a homogeneous group. And I think that's why we keep talking about inclusivity and hearing and consulting different people, young women and girls. So now we are actually running out of time. We're about to wrap this up. I see so many questions and answers coming in. I would like to implore you to please keep those questions coming. We've had several speakers that have shared their insights and perspectives, and you want to ask a question, you want clarification on something, and they are available to address your concerns and to really just respond to your questions. So please to use the chat box, and do not forget Adolescent, hashtag Adolescent 2030 and hashtag CSW66 as you are tweeting, Facebooking, and Instagramming and TikToking away. I'm not sure if TikTok works in this context. But we're going over to the inclusion of women and girls with disabilities in the pandemic. And we have Professor Laverne Jacobs from the University of Windsor at the Faculty of Law, and is also the founder of the Law, Disability and Social Change Project, which is a research and public advocacy initiative that is housed at the Windsor Law that works to foster and develop inclusive communities. So Professor Jacobs, what are your reflections on the main challenges and policy opportunities for women and adolescent girls with disabilities being effectively included in the pandemic response and recovery plans particularly? And if you could also kindly share with us how you think we should ensure commitments turn into sustained actions to deliver on these. Over to you, Professor Jacobs.
Hello, thank you to the organizers for the invitation to be here today. And it's truly an honor and a pleasure to be able to discuss these important issues as a member of this panel. I've been extremely energized by listening to my co-panelists. So thank you very much for the question. I'm going to address your first question in two parts. First, I think it's necessary to take stock of the issues faced by women with disabilities and adolescent girls with disabilities during the pandemic. So this includes but goes beyond health, as many human rights are interdependent. Second, I'll highlight the challenges and opportunities for women and adolescent girls with disabilities when it comes to being involved in policy making related to pandemic response and recovery. During the COVID-19 pandemic, women and adolescent girls with disabilities have either faced challenges that other persons with disabilities and non-disabled people have not faced, or the negative impact of the pandemic and its measure have affected women and girls with disabilities disproportionately. During the pandemic, some of the main challenges experienced by women and adolescent girls with disabilities related to one, ensuring adequate supports such as personal support workers, support for mothers with disabilities, and for mothers of children with disabilities. Two, ensuring the safety of women and adolescent girls with disabilities from gender-based violence, including intimate partner violence. And this became particularly problematic with the requirement of sheltering in place, which brought risks to those who lived with their abusers. Three, ensuring access to education. This is another issue facing women and adolescent girls with disabilities that became even more significant because of the pandemic. Outside of the pandemic, women and girls with disabilities already faced barriers to education due to gendered and ableist stereotypes. During the pandemic, we saw an even greater challenge with the move to technology and online learning in some jurisdictions without the requisite support for students who did not have access to technology, and without support for students with disabilities who required support in the classroom. Fourthly, and finally, women and girls with disabilities face high rates of poverty around the world, both before and during the pandemic, and generally a lack of economic security. As for the second part of my answer, there are a number of challenges hindering the development of policies that include issues relating to women and adolescent girls with disabilities. We have witnessed during the pandemic, we have witnessed this during the pandemic and in relation to the pandemic recovery. These challenges exist in numerous jurisdictions and generally stem from at least three issues. One is the lack of inclusion of women with disabilities at the policy-making table, and we've heard some discussion about this. A second is a lack of information by policymakers on the issues faced by women and adolescent girls with disabilities, including intersectional issues. And at times there can be a lack of political will or resources to address these issues. Yet, moving forward, there are also opportunities at this juncture to leverage what we have learned from the pandemic in order to improve some of the long-standing barriers affecting women and adolescent girls with disabilities. And let me just give you two examples out of many. One such opportunity relates to improving educational opportunities and outcomes for adolescent girls with disabilities. According to research studies, such as one conducted by the Asia Deco Group in 2020, the work world post-COVID may be more digitally focused in many jurisdictions. And this was also alluded to briefly in the film at the beginning of our panel. This provides an opportunity for policymakers to improve the level of education of women and adolescent girls with disabilities so that they have sufficient education to prepare for a work world post-COVID. In doing so, policymakers would also be moving towards a better fulfillment of the right to education and the right to equality for women and girls with disabilities under the Convention on the Rights of Persons with Disabilities. Under the Convention, states parties must ensure that persons with disabilities, in this case adolescent girls with disabilities, are provided with inclusive, quality, and free secondary education opportunities that accommodate and support them. States parties must also provide access to general tertiary education, vocational training, adult education, and lifelong learning without discrimination and on an equal basis with others. And finally, under the Convention on the Rights of Persons with Disabilities, women and girls must be ensured their full development, advancement, and empowerment. In addition to improving education, another opportunity to learn from the pandemic is in the area of gender-based violence. Shelters and other safe spaces for survivors of gender-based violence need to be designed to be accessible for women and adolescent girls with disabilities. Shelters should also be designed so that they are free from other forms of intersectional discrimination and welcoming to disabled women from LGBTQ to S+, ethnic minority, and other additional marginalized communities. So how do we ensure commitments turn into sustained actions to deliver? First, issues have to be kept on the agenda. One way to do this is through disability awareness campaigns by advocates. Another way is for governments to institute mechanisms such as commissioners for issues relating to women and girls with disabilities. A third way is for women and adolescent girls with disabilities to be part of government so that they can push for change at that level. And so the question then arises, how do we best address these issues? And one thing I'll say is that there may be room to draw on the convention's general comments. The general comments relating to women and girls with disabilities under the CRPD recommends that governments remove barriers and actually take action to ensure the equality of women and girls with disabilities. And I think that proactivity on the part of those who can make change, such as government policymakers, is essential for policy making ideas to turn into reality. So that's one thing that I would recommend, some more proactivity where it doesn't exist. I will stop there. I just want to mention that I have shared or will share a couple of resources. They'll be placed in the chat. One is a parliamentary brief on the impact of COVID-19 on women with disabilities in Canada by the Disabled Women's Network of Canada. Another is a link to a conference on inclusive post-secondary education, examining the barriers that exist for persons with disabilities in that context, being held at Berkeley in the spring. It's one area, post-secondary education, where I think women and girls really can make a difference. You know, we need more information, we need more research on what the barriers are so that we can make the difference and ensure that they are well supported in that context. So thank you very much.
All right, thank you so much for that, Professor. And that wraps up the end of our panel discussion. And like we mentioned earlier, that this 90-minute discussion was going to highlight the lived experiences, which we've obviously heard from an amazing activist, young activist, Isadora, who has moved so many of us and has empowered so many of us. We're also able to hear about the current challenges as well as the policy opportunities for adolescent girls, especially for those with disabilities, and outlining the critical next steps to promote their inclusion in pandemic response and recovery plans. And what I really liked about this dialogue was that it was very practical, lived experiences like we shared, best practices, and everybody else who has joined us has been amazing. Thank you so much for your contributions in the chat box, your questions, which we're actually about to get to. So we're actually running out of time. We've got a few minutes left, but we have a couple of questions. We will start with these two questions which are directed to Isadora. And before Isadora comes in to respond to those questions, I want our panelists to start thinking about their last reflections. What are your last remarks? Because I will just give you 30 seconds to just share your last remarks. So make it powerful, and I know that's not going to be a problem for you because everything that you've shared has been inspirational, has been very moving, and we're looking forward to hearing what your last reflections are. I'm just going to go over to Isidora. So you have a couple of questions, but I'm just going to sieve out two. We've got one from Sanjay Kaul. Apologies if I'm not pronouncing that correctly, but Sanjay asks, what disability does Miss Isidora has Miss Isidora suffered, and how has it influenced her life? I know you'd already touched upon this earlier when you'd started, but I'm assuming that there are other people that joined in late. And then we also have another question from Joyce Oma, who says, powerful intervention, Isidora. Thank you for speaking for women and girls living with disabilities in all diversities. Do you think the policy environment is responsive to the unique needs of young women living with disabilities in and out of schools? Thank you so much for your questions. Apologies that we can't do live answers, but our panelists are also typing and responding in the chat box. So please do keep them coming before we wrap up. Over to you, Isidora.
Thank you so much for all your questions. Well, I'm going to start which is my diagnosis. I have cerebral palsy because I was born when my mom was on the 6th month of pregnancy. That's why I have this physical disability. And well, I had a lot of experience in relation to this, even in relation to the empowerment, because since I was very young, I was selected to be like an ambassador of one rehabilitation institution here in my country, who is called Teleton, and I have to like represent all of these people in the fundraising campaign who was on television. Then I act on a soap opera in my country representing a girl of 9 years old for the first time with a real disability. And then I started my journey as an activism in relation to inclusion and people with disabilities rights. And then with the pass of the years, I realized about feminism and the intersectional approach that we could give to this current and all the things in relation to women and girls' rights. So that's like a brief of my life and how I started in this journey, like representing people on television. And then I realized that I really want to do something systematic in public policies as an activist. Then if I have to go with the second question, let's start acknowledging the Latin American reality. Here, 7 to 10 children with disabilities do not attend to the school. They leave the school. Imagine, only 3 people of this amount are in school now. And if we think in my country, we don't have even universal accessibility. So let's not consider the specific way of women and girls' rights in schools, starting on that point. Also, we have a system who divides the school in 2 ways. The public, that are obligated by the state to have public policies in relation to inclusion, gender, and sexual and reproductive health rights, and the private schools that are not with this law and obligate to be part of the inclusion of people with disabilities. So when you are in the private system, as I am in this moment, it's super common that in these schools, they even didn't know you and they say, no, I don't want to accept you because of your disability. What if you need a nurse? What if you need maybe the restructure of the school and they even didn't know me? That's the worst part. But what's matter if we need a nurse, if we need more accessibility? These are political issues and we need to be involved in them. People with disabilities rights are human rights, and that's the issue with this. We haven't considered these rights as part of the solution, as part of something systematic. We only focus on few things as health or therapy, but now in the matter. Are you muted?
Wow, I don't know why that keeps happening, but thank you so much, Isidora, for those wonderful contributions, very insightful and very powerful as usual. We're very proud of the work that you're doing, and we know that you are empowering and have inspired more adolescents out there to just stand up, to speak out, and to really take action. Before you came in to respond to those questions, that asked the panelists to think of their final reflections for 30 seconds. Unfortunately, we're not doing very well with time, so I would like to kindly ask our panelists to just type into the chat box your final reflections. We would really love to hear from you before we go, as we go over to the closing remarks. And I would like to give the floor to Catherine Guernsey, who works at the USAID Disability, who is the USAID Disability Rights Coordinator. Over to you, Catherine, with the closing remarks.
Thank you, Maziko, for the opportunity for some very brief reflections. I will truncate my remarks in light of the time, but thank you to you and everybody who helped to organize today, to the panelists for the rich and comprehensive discussion, and a particular thanks to Isidora for keeping us grounded in the essential perspectives of adolescent girls with disabilities. We live at a time with one of the largest youth populations in history that over the past 2 years has experienced unprecedented challenges with the pandemic and ongoing challenges associated with various crises, from climate change to conflicts and other humanitarian risks. Having heard today of some of the challenges and opportunities as they relate to adolescent girls with disabilities, there is no question that our societies can and must do better to include adolescent girls and young women with disabilities as we respond both to the pandemic and commit to building back better, not only in the area of access to health, including mental health and sexual and reproductive health, but across all areas of life. We note that adolescent girls and young women with disabilities are too often absent from leadership positions, and this is an issue that we've been seeking to address in our engagement across the United Nations, including in UN Security Council Resolution 2475, and here at the Commission on the Status of Women. At USAID, we're certainly considering how we can better apply a disability lens to our efforts across a range of related portfolios and consistent with our long-standing commitment to disability inclusive development. This includes taking a system strengthening approach to a range of services, including healthcare, as called for in our Advancing Protection and Care for Children in Adversity strategy. It means consistently applying a positive youth development approach. And perhaps most importantly, it means situating adolescent girls with disabilities at the center of our work. And that in turn means respecting the agency and leadership of adolescent girls with disabilities. And on that note, we welcome any youth with disabilities joining today to visit www.youthlead.org, a USAID-supported online platform hosting a network of like-minded young changemakers positively impacting their communities through service, activism, advocacy, education, and entrepreneurship. In closing, adolescence is for sure one of the most important phases in the ages and stages of life. I'm sure many of us here today can attest to the impacts that our own experiences from that time have had on our adult lives. In doing so, we must surely recognize the responsibility that we share to make the necessary changes to help ensure that adolescent girls with disabilities can live this stage of their lives to their fullest potential, so that the sacrifices and suffering of the last 2 years during this pandemic need not be in vain. Thank you very much.
Thank you so much for that. Very powerful. Unfortunately, we are running out of time. We're about 2 minutes over time. And I would really like to thank you all for still staying with us and sticking with us. With that, I would like to thank everyone once again who participated in today's event, for the insights from the panelists, for the questions, comments from the audience. Your engagement has been amazing. As many have said, if we are serious to achieve SDGs and walk our talk, to deliver on our commitments for the universal health coverage and the sustainable development goals, the recent Disability Summit and others, the key is to ensure sustained and consistent involvement of all adolescent girls, because it is nothing for them without them, as we usually say, and undertake this work in partnership. As Helen Keller has said, I am only one, but still I am one. I cannot do everything, but still I can do something. And because I cannot do everything, I will not refuse to do something that I can do. Together we can, PMNCH, the world's largest alliance on women's, children's and adolescents' health of 1,200 members, is organizing the Global Summit on Adolescents and on adolescents' health and well-being in 2023. Let us raise awareness, work together, and deliver inclusiveness and equity for girls everywhere. And before we finally wrap up, I hope that we can use this chat box just for the last few minutes we have to just share our reflections and everything. But from all of us at PMNCH and all of us that have supported the event, thank you so much. You've been amazing. And if you want to follow the conversations today, hashtag Adolescents 2030, hashtag CSW66. And as we'd say, we will share we will share the recording. So I'd like to just ask us to just maybe just wait for 60 seconds. I can see our panelists are sharing their last reflections. I know we're out of time, and thank you so much for sticking with us. Please do for the next 60 seconds. And thank you so much for your engagement. You guys are amazing. Thank you.
Thank you very much. We'll leave the webinar open for around 60 seconds or so, just for everyone to review the final chat comments. But thank you all very much for such an inspiring webinar, and we'll be closing this webinar shortly. Thank you very much.